Hi, my name is Jason Lauritsen. In today's lesson, we're going to be providing information to students regarding the reason for wearing a mask to protect public health and how to properly wear a mask. Today we're going to need one disposable mask per person, access to hand sanitizer, and an overhead projector display screen to present the infographics. So today we'll be learning why mask wearing is important for public health during times of high spread of COVID-19 and other highly contagious respiratory illnesses. We'll then learn how to properly wear a disposable mask. So first thing, we're going to put up the first infographic from cdc.gov. If you look at it, you can see if kids get infected with Delta, are they at risk for serious illness? So this is just an overview telling us because the Delta variant is more contagious than past versions of the virus, the concern is that more kids will get COVID-19 and spread it to others. We know based on national antibody studies, some children don't have symptoms but are infected and can spread the virus. Protecting people from COVID-19 is more important than ever, especially those who are unvaccinated, including those too young to be vaccinated. And if you live in an area with substantial or high COVID-19 spread, you should have your children who are 2 years or older wear masks in public indoor settings, including school. So, according to the Center for Disease Control, our nation's health protection agency, if you're fully vaccinated, you can start safely doing more activities again. However, the more contagious Delta and the brand new Omicron variants are still spreading across the United States, and breakthrough infections can occur. Health experts are encouraging all people to wear a mask indoors in public if they are in an area of substantial or high transmission, which we are currently in our area. Wearing a mask in places with higher potential transmission will help protect you against the Delta and Omicron variant and prevent you from possibly spreading it to others. If you or someone in your household has a weakened immune system, is not yet vaccinated, or is at increased risk for severe disease, you should consider continuing to wear a mask anytime you're around people outside your household, even if you are vaccinated or the level of transmission is low in your area. You should continue to wear a mask where required by laws, rules, regulations, or local guidance. CDC is continuing to update guidelines as more information becomes available. Okay, so the next thing we're going to do is talk about, so we just went over the why we should wear a mask. Now we're going to go over how to wear a mask. Once again, if you can refer up to the infographic from the CDC, it's giving us instructions of how to wear a mask properly. So the first thing we're going to want to do, I like to call it step 0, since we have step 1 up on the infographic, is we want to start and make sure that your hands are washed or using an antibacterial hand sanitizer, which we have right here. So you're going to put on hand sanitizer, make sure it's in. So that's just making sure that you're not contaminating the mask as you put it on. So once your hands are clean, you're going to take a disposable mask. It'll be in a sealed container. You're going to take the mask out, and the first thing you're going to do is ensure the proper side is going out. This one's directional. Some of the paper masks, it's harder to tell, but if you're using a paper mask right there, the white side will go towards you and then the color side will go out. So once you ensure that the proper side of the mask is facing outward, and also there will be a metal strip in these, make sure it's up so it'll go on your nose. You're going to secure the strings behind your head or over your ears. This one goes over your ears, so holding it by the string, we're going to put it back over your ears. Next step, if you look at the infographic, step 3, press the metallic strip to fit the shape of your nose. And step 4 is the important one. Cover mouth and nose fully, making sure there are no gaps. A lot of people, you'll see them with their, like this, or on their chin. To work properly, it has to fully cover both your nose and your mouth. Step 5 is the easy part, wear your mask. Step 6, looking at the infographic, an important part of this is you do not want to touch the mask while using it. When it's working effectively, it's going to be capturing any airborne particles on the out. If you touch it or think about it or need to reposition it, you need to make sure you wash your hands or grab some more hand sanitizer. So step 7, we're going to talk about how to properly remove your mask. So when you're back home or in a place where you're by yourself and it's time to remove your mask, you're going to want to remove the mask from behind by holding the strings with clean hands, and then put it away or dispose of it. And then the last thing, we'll call it step 7.5. Once again, after touching the mask, you're going to want to wash your hands again or use hand sanitizer. So that is how to properly wear a mask. We've went over why we should wear a mask. The next thing we're going to talk about is why to wear a mask, as in what does it actually do. You'll hear from a lot of people that, well, if you want to wear a mask, it's not going to affect me, yada yada. So if we look at the third infographic up on the board here, you're wearing a mask not only to protect yourself, but you're wearing a mask to protect others. If we look at the infographic, if you have one person with COVID-19 and you have another person that doesn't currently have COVID-19 and they're interacting in a classroom setting, in a work setting, however it is, the highest risk of spread from the COVID-19 positive person to the COVID-19 negative person is if both people are not wearing a mask. COVID-19 travels from respiratory particles. They travel along with your out breath, if you sneeze, cough. So there's a high risk of spread when you have two people interacting and neither of them are wearing a mask. One of them is COVID positive. If the non-COVID positive person, if you look at the infographic, it shows it does help slightly if the non-COVID positive person is wearing it, but there still is a moderately high risk of transmission. If the COVID-19 positive person is wearing a mask and the non-COVID positive person isn't wearing a mask, that's going to be more effective than vice versa, if, as you see above, with the moderately high risk if the healthy person's wearing a mask, because as you noticed when we were wearing it, it's not airtight, little bit of air slips around the side, that kind of stuff. So if there's particulates in the air, it has a higher chance of getting to you, whereas if the person who is COVID positive is wearing the mask, there's going to be less transmission of the particles as they're breathing out. And then the lowest level of risk with mask wearing is if both people are wearing a mask. I mean, you know me, when I'm not teaching a health lesson, I'm a math person, and statistics and probability, we talk about that a lot. There is a big difference between two people not wearing masks and transmission rate and two people wearing masks. So once again, study the infographic here and you'll know highest risk to lowest risk. So the last thing we're going to wrap up with here is, do we have any questions regarding this? I know there's a lot of misinformation that is getting spread out there about masks and the dangers and risks of it. Okay, yeah. You got a question? Okay, so that's one we commonly hear. I don't know if everybody heard that or not, but the question asked was, I've heard that if you wear a mask, you're going to be rebreathing your own carbon dioxide and it's unhealthy. That is completely false. That's very commonly spread myth by people that aren't very savvy with math or science. I'm just going to give you two examples of why that is not an issue. Think about the fact you guys have watched TV shows with doctors or books or something that you've come in contact with it. A heart surgeon will wear a surgical mask for sometimes if they're doing a heart transplant for 10 to 12 hours. If they were rebreathing their own carbon dioxide or it was causing any health concerns, it would come up in that situation. Whereas if you're, wearing a mask for 20 minutes running into a grocery store or even in a classroom setting like we are now, we have a lot of mask breaks. You get a chance to take it off, take a break. So that's the anecdotal. I mean, we know that we would hear about issues from doctors if that were the case. And going back to, once again, I'm a math person. We talk about a lot of math statistics in this class. The simple fact is the infinitesimally small size of a carbon dioxide molecule or an O2 molecule. To put it in perspective, if we think of the size of those molecules, they're very close in size. CO2 is a little bit bigger, but if we thought of those as the size of a ping pong ball, so we're talking about 1.5 inches in diameter. Mask that we're commonly wearing, either the cloth ones or the disposable ones, the weave is loose enough that the holes in those, if we compared them to a CO2 or oxygen molecule as the size of a ping pong, the holes in the mask would be the size of a mile-wide hole. So there aren't any real concerns about rebreathing carbon dioxide when we think about the fact, would you be worried about a ping pong ball being able to fit through a mile diameter hole? So that's not an issue. So if there aren't any other questions, we're about at the end of our time here. So what we're going to finish up with is a quick assessment just to see how our understanding went on this. So I'm handing it out now, and if you can take a look at it. So up at the top, you're going to see it says mask wearing lesson assignment. I want you to add your name in that section, and then what period this is. And then we're going to have 4 questions. The first one is a rank choice question. I'm going to read it to you here. Please rank the levels of protection from 1 being the most protected to 4 being the least protected when 2 people are interacting and one of them is COVID positive. So if you think about the infographic that we had a little while earlier, and it's going to give you 4 scenarios. Only the COVID positive person is wearing a mask. Only the COVID negative person is wearing a mask. Both people are wearing a mask, or neither person is wearing a mask. So you're going to want to rank those 1 through 4, 1 being the most protected and 4 being the least protected. And then we have a couple short little essay questions. They're more like just a sentence or 2. The first one's going to be, what is the first thing you should do before putting on a mask and after taking a mask off? So that's going to be number 2. Number 3 is, according to the CDC, why is it important to wear a mask? So that one, you could have several right answers for it, so just give me one of those. And then the last question on the assessment is going to be a true and false. So circle either true or false. The question is, to be properly protected when wearing a mask, it only needs to cover your mouth. So I'm going to give you about 5 minutes at most to finish that. Once you're done, go ahead and bring them up to the front of the classroom, put them into the box there. And are there any questions before we get into the assessment? Okay, well, thank you very much, and I'm going to pass out the assessment right now.